Congratulations, you're on your way to a beautiful smile. Here are some instructions on how to take care of your braces. Brushing. It is very important to keep your teeth clean. Make sure you're using a 45-degree angle when brushing around your braces. Assistants will be checking your hygiene each time you come in for an appointment. Parents, please make sure to ask our team how your child is doing so we can make sure there's no decalcification marks on your child's teeth when treatment is finished. Let's Smile also strongly recommends that you see your dentist every 3 to 6 months for your cleaning and checkup appointment. Our goal is when treatment is finished that you have not only a beautiful smile but a healthy one. Flossing. It's equally important to eliminate potential swollen gums throughout your treatment. Remember to allow yourself enough time because it can be a lengthy process in the beginning. We recommend flossing once a day before bedtime. There are 2 methods of flossing we recommend. The first one is the platypus ortho flosser. This peck is special because it has a flat end that allows it to fit underneath the wire. Perfect. The second one we have is a floss threader. It comes into a pack, and then you tie your floss to the edge of it. Once you have it tied through, you can then thread the floss underneath the wire. Good job. Interproximal Toothbrush. This small toothbrush is designed to fit into those hard-to-get places that your folds-tied toothbrush may miss. Apply a little toothpaste and then carefully brush in between your brackets. Wax. You may experience some cuts or sores when you first get your braces on. This will improve in the future. Use the wax to help smooth the surface on the braces so the inside of your mouth has time to heal. Take the wax out to eat and replace it as needed. Wax will also help you if a wire is poking or if you have a broken bracket. If you happen to swallow the wax, no need to worry, it's not toxic. Repairs. Your braces can break if you eat the wrong foods due to pressure issues or if contamination occurs during the bonding procedure. If a bracket breaks, please do not panic. As long as the patient is not in any pain, a bracket can remain off for up to 2 weeks without resulting in extra treatment time. Keep the bracket and notify the office of the breakage. We will do our best to accommodate you. For your convenience, we also have staff on call to answer any repair questions you may have. Please be advised that we do have a 3-strike rule. After 3 repairs, there will be an additional fee associated to repair it. Peroxyl and Orabase. If you get a painful sore or cut in your mouth, switch with some Peroxyl Rinse to help promote the healing process. Orabase can also be used. It's a numbing agent that's similar to Oragel. Both of these products can be purchased over the counter. Foods. Please avoid eating foods or candy that are sticky or hard. Sticky foods include gum, taffy, gummy bears, etc. Hard foods include such as nuts, chips, Fritos, Doritos, ice, and hard breads that will break your braces. Also avoid biting into certain food whenever possible, like apples, ribs, corn on the cob, and chicken. For those foods, we ask that you cut them into pieces. You are provided a magnet that you can put onto your fridge that also give you a little bit of a guideline.